Hi, dear audiences. I'm so pleased to have another opportunity to talk to you. This time I've decided to speak in English so as to have a wider scope for audiences internationally. This time I'm going to talk about an anxiety disorder. You know, many people are suffering from an anxiety disorder. It is a kind of problem that thousands of people are daily dealing with the problem, and they are exposing many sufferings. First of all, we should understand that there is a very clear difference between an anxiety and stress. You know, when we talk about an anxiety, there is a kind of unknown source. But when we are talking about stress, we know that stress or fear has a very specific root. For example, I may have a stress or fear from dogs. When you're anxious, you do not know exactly what is the reason for that, what is the underlying reason for that, you know. And being anxious can be related to the past, can be related to present, and can also be attributable to the future. So it is a very, very complex issue, and and it is also bound to human being. And animals are not suffering from an anxiety. They have the sense of fear, but they are not suffering an anxiety. Many disorders are also related to anxiety. For example, OCD, obsessive compulsive disorder, which means the intrusion of constant undesirable thoughts to the mind of the person are causing too much anxiety. And the person tries to fight against this anxiety by doing some rituals, some activities in order to neutralize these kind of intrusions coming from the mind of the person. Another type of anxiety is generalized anxiety. Generalized anxiety is a feeling that a person all the time is impatient, all the time is irritable, all the time is feeling stress and worrisome without knowing the main reason for that. When you talk to these people, they say, well, I don't know why I'm so. When I'm talking on phone, when I'm talking to my friends, when I'm talking in public or doing my daily work, I'm suffering from this feeling and I don't know exactly what to do. The people suffering from generalized anxiety have very bad time most of the day and night. Another type of anxiety is about phobias. Phobias are unreasonable fear from things that might be very usual for people. For example, some people are too much feared from blood. When they see someone bleeding, they may faint, they may become fainted, and they may lose their mind. And there are many different types of phobias. For example, social phobia. The social phobia, the person suffering from social phobia might avoid from many of social events, even visiting friends, even going shopping, and things like that. Another type of anxiety is specific anxiety, and in addition to it, we have the type of the panic attacks. You know, panic attacks is the maximum of the sense of an anxiety. The person who suffers from panic attacks is really terrified. The person experiences a very high rate of the heart, at the same time panting as if he's going to be suffocated, and all over her body is covered with perspiration. Covers all over the body, and symptoms like this, and it is a very tremendous attack, because the panic attacks are coming to persons suddenly, and their symptoms are very similar to the heart attack. For this reason, many people who experience panic attack think that they are suffering from heart attack, and they refer to the hospitals, and after that then the experts say that no, it has a psychological root. What is the reason for anxiety? There are many factors. The first and the most important one is genetic factors. Those who have anxious parents, there is very high possibility that children have the same problem too. In addition to genetic factors, the condition of life is also important. When children are experiencing trauma in their life, when children are living in a family which is not friendly, they are feeling this disorder. They are feeling worrisome. They are feeling the unpredictability of their life, and for this reason, most of the time, they are worried, anxious, and they are in the doldrum regarding their future. Some bad experiences in the later stages of one's life is also attributable to an anxiety disorder. In addition, based on the Freudian psychoanalysis, the constant tensions between ego and superego, or the conscious and unconscious, paved the way for this kind of undesirable feeling, which according to Freud is an inseparable part of human self. We have also some theories regarding the anxiety in Gestalt psychology. The proponent of Gestalt psychology believe that those Gestalt cycles that have not been successfully finished may lead to an anxiety. For example, if the person who has loved another one has not expressed his feeling toward her, it is possible that in future the panic attack, the anxiety, social phobia, or any kind of anxiety differences attack to this person. According to behaviorists, the operant conditioning and the relationship between a stimuli and a reinforcement, if they are not conducted in a through systematic, logical way, also may lead to the sense of anxiety. Anyway, there are some medications, benzodiazepines, SSRI, serotonin reuptake inhibitors, beta blockers, are among the most used, the most applied medical sources for solving this problem. And just as always, I'm not going to refer to any specific medicine because it is the duty of a psychiatrist, not a psychologist. Thank you very much for listening to these talks, and in future I would continue reporting on different types of disorders, and I hope you find it interesting. Thank you.